Today, I'm going to demonstrate how to inject efgartigimod subcutaneously. Find yourself a comfortable worktop. Remove all items. Spray and clean the surface of the worktop and dry with paper. First of all, we take the box with study medication out of the fridge and check the labels. Please read the paper guide for detailed instructions. All right, let's get started. You'll need to collect all the necessary injection supplies. You will need a syringe, a transfer needle, a winged infusion set, the study drug vial, an alcohol swab, and a sharp objects disposal bin. Please make sure the study drug vial is acclimatized for 15 minutes. Okay, you have everything you need. Now you just need to wash your hands again with soap and water and dry them thoroughly with paper. Let's get the vial ready. Take off the cap. Clean the rubber stopper with an alcohol swab and allow to air dry for 30 seconds. Open the syringe package, leaving the syringe in the package. Open the needle package, leaving the needle in the package. Attach the transfer needle to the syringe. Push and twist the transfer needle clockwise until it's fully attached. Now, pull back the plunger to draw air into the syringe to the same measurement level on the syringe as your prescribed dose. In this example, we have 6 milliliters. Once that's done, uncap the transfer needle. Don't throw the cap away because you'll need it again. Put the vial on a flat surface. Insert the needle and syringe straight down into the center of the vial stopper. Once the needle's in the vial, turn the vial and syringe upside down. Ensure the needle tip is above the solution and gently inject the air into the vial. Make sure to keep your finger pressed down on the plunger. Do not inject air into the solution as it could create air bubbles. Next, slide the tip of the needle down so that it is in the solution and fill the syringe with the correct amount. Be careful not to pull the plunger out of the syringe. To remove any large air bubbles, just tap the syringe with your fingers until the air bubbles rise to the top. Next, move the tip of the needle above the solution and slowly push the plunger to get the air bubbles out. Repeat these steps until you have removed all larger visible bubbles. Before moving on, ensure you have the right amount of the study drug in the syringe and, if needed, adjust the amount in the syringe to the correct dose amount. Next, remove the syringe from the vial and place the cap back onto the transfer needle. Push the cap down to fully attach it. Check the content of the syringe. The amount should be your correct dose and there should not be any particles or air bubbles visible in the syringe. Remove the transfer needle from the syringe by twisting it counterclockwise. Throw away the transfer needle in a sharp objects disposal bin. Open the package of the winged infusion set. Unscrew the cap. Then, connect the winged infusion set to the syringe by pushing the connection clockwise until it is fully attached. Fill the infusion set with the needle guard on and the syringe held upright. Gently press the plunger to fill the tube to the tip of the infusion set. Make sure there are no air bubbles in the line. At the end of the process, the plunger on the syringe should now contain the exact prescribed dose. Take a seat on a comfortable reclining chair with all material for injection and sharp objects disposal bin by your side. Now it's time to choose your injection site. Check the paper guide for instructions on how to select the correct injection location. Then, you'll need to disinfect the injection site with an alcohol swab in a circular motion from the center outward and wait for about 30 seconds while it dries. Now you are ready to inject the study drug. Remove the needle cap and throw it away into your sharp objects disposal bin. Pinch the skin on the spot you chose for your injection. Do not hold the skin too tight to avoid bruising, and make sure there is enough space for the needle to be inserted under the skin. Hold the wings of the needle and insert the entire needle at a 45 to 90 degree angle into your skin. Once the needle is in, release the pinched skin. Now slowly inject the study drug over approximately 1 to 1.5 minutes. Then remove the needle at the same angle of insertion. Since you can only use your needles and syringes one time, you can now throw them away in the sharp objects disposal bin. Always keep the sharp objects disposal bin out of reach of children. After the injection, if needed, attach a bandage. When you're done, complete the administration log and return the complete log to your doctor upon your next visit. Thank you.